hello ma'am. Good day. I am from BSN 1A. So before I will start my demonstration, I just want to explain to you that assume that my patient doesn't know that I am assessing his respiratory cycle, because if he knows that I am assessing his respiratory cycle, he may fake his breathing pattern that may alter his result in respiration. Okay, so assessment. Identify patient using at least 2 identifiers according to agency policy. So, hello sir, can you tell me your name and your birthday to confirm your identity?
My name is Benj and my birthday is January 24, 2006.
So, thank you sir. Next, reviews patient's EHR to assess for factors that influence the patient's respirations. Determine previous baseline respiratory rate from patient's EHR. Assess patients or family caregivers' health literacy. Perform hand hygiene. Assess for signs and symptoms that influence the patient's respirations. Assess for signs and symptoms of respiration alternations. Assess patient's knowledge of and prior experience with respiratory measurement and feelings about the procedures. So let's go to planning. Determine expected outcomes following completion of procedure. If patient has been active for 5 to 10 minutes, prepare 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 or prepare or prepare prepare SBP respirations. Ensure that the patient was in comfortable position to return to, to return a lying or beating with head elevated to 45 to 60 degrees. Provided privacy and explain procedure to patients. Organize and set up any equipment needed to perform a procedure. Ensure that patient's chest was visible when necessary. Move bed linen or gown. Assess our respiration factors measurements in adults. For the implementation, perform hand hygiene and place patient arms in relaxed position across abdomen or above chest, leaving fingertips on the wrist, or place own hand directly over patient's upper abdomen. Next, observe complete respiratory cycle. Um, After observing a cycle, look at second hand of watch and began count rate. When sweep hand hit hand number on dial, began time frame counting with one first full respiratory cycle. Then when rhythm was regular, count the number of respirations in 30 seconds and multiplied by 2. When a rhythm is irregular, less than 2 and less than 12 and more greater than 20, count for one full minute. Noted that of respiration by observing degree of a chest wall movement while counting rate. Assess a depth by palpating chest wall, exposure, or auscultating posterior thorax after rate counted. Decide depth at swallow, normal or deep. Noted noted rhythm noted rhythm of re, noted rhythm of ventolin cycle. Not confuse signing with abnormal rhythm. So I will touch your hands, sir. Okay. So your respiration, sir, is 14, and it is considered as normal because the normal range of respiratory cycle is 12 to 20. Then replace bed linen or on patient's gown uh, if patients and help patients in a comfortable position. Inform patients respiratory rate and documented per AG policy. Uh, this dispose of all contaminated supplies in appropriate receptacles. Remove and dispose of gloves if worn. Perform hand hygiene. Raise side rails and lower bed in lowest position, locking into position. Place nurse call system in accessible location within the patient's reach. And for the evaluation, when assessing respiration for first time, establish rhythm and depth as baseline when within acceptable range. Compare respiration of patients from previous baseline and use usual rate, rhythm, and depth. Uh, orally, ano? Correlated, correlated respiratory rate, depth, and rhythm with uh, with intact pulse oximetry and intact pulse oximetry and managing imaging measurement when available. Use stitch back. So revise instruction if patients and family caregivers uh, when uh, when uh, uh, when patients or family caregivers was not able to teach back correctly.